Welcome to the Healthy You. I am Dr. J, board certified by the National Board of Physicians and Surgeons, family physician. I practice at St. John's Direct Primary Care, a functional medicine, family medicine practice that develops individualized healthcare at your convenience. So today we're going to talk about healthcare and all the disparities, because with everything going on, I think a lot of people don't realize what some of these organizations do, like the WHO, Health and Human Services, the Environmental Protection Agency, the CDC, and how it all relates to us. Because there are health disparities. They're not in the United States, they're in the world. Let's start with the WHO. That stands for the World Health Organization. It started in Switzerland. It was established in April in 1948 in response to the need of global health authority to improve and coordinate the health of the world. After World War II, there were significant disparities in health standards between the countries. A lot of nations lack resources where other nations had to fill in. And there was so much infectious diseases and poor health standards that they all decided to get together and on a global basis promote health equity among all the nations. So WHO is the global health leadership of coordinating international health activities and global health matters, watching the diseases that pop up over the world. Because with travel, people are everywhere. And as people move and migrate, so do diseases. The WHO developed international health guidelines and standards that takes everyone into consideration. Because traveling internationally, you'll go over to an area, the water would be different, and you can get deathly sick. Malaria, dysentery, people who are moving back and forth, they need to be aware of this and aware of what not to drink, what not to eat, because everybody doesn't prepare the food the same. Everybody's water is not the same. It also was developed for health emergency responses, coordination of international responses to help with health emergencies, like during war, during disasters, hurricanes, tsunamis, volcanoes erupting, any type of environmental, the structure of the countries where people live, where public health. And it also assists countries in strengthening their health systems. If we have the vaccines for polio and you're in a third world country and people are still having polio, we share this information. We share vaccines. We help them out. The last thing they do, they monitor and collect data and publish reports on global health records. If there's an outbreak in a certain area and these people are getting on a plane coming to the United States, we need to know that. What is the CDC? What are their duties and responsibilities? Infectious disease control. That's what the CDC is for. They monitor, prevent the spread of infectious diseases in the United States and globally to keep us all safe. As humans, we can be affected by all type of viruses, bacteria, worms, fungi. We're at the top of the food chain almost, but there are things that can eat us and kill us. So I guess we're not. But this is important because there are things we can do to mitigate our risk of being destroyed, eaten, taken over by these diseases. Because a lot of it could be from filthy water, because the animals poop in the water, the humans poop in the water, GI bugs that actually can get in the water, and we call them gram-negative bacteria. If they get into your system, then they can kill you and cause sepsis. So these organizations were set up to help monitor this, because on a day-to-day basis, I don't have time to do that. I'm sure you don't have time to do that. So our government takes care of all that for us to keep us safe. So we can go out to eat dinner, we can prepare our food, and it also looks at these health threats And it tracks the diseases and outbreaks like COVID, like the flu, the bird flu, measles. CDC provides public health information and education to prevent diseases. Why this is important: if you've ever gone to your doctor or to the ER or the urgent care, they always ask you when you check in, have you been out of the country lately? Where have you visited to lately? You know why they ask those questions? Because if you have a fever and say you've been to Africa or over to Vietnam, then they know to check you for malaria, typhoid. And guess where this information comes from? The WHO to the CDC, who provides it real time to physicians in the urgent cares and the emergency room. And it tells us how to treat it, because they also give us information on which antibiotics work, in which area those antibiotics don't work anymore because those bugs have gotten smarter. And when the bugs get smarter, they mutate so that they won't die from those antibiotics you take. So then we have to adjust our antibiotic. And who monitors all of this? They do. The CDC and the World Health Organizations. The CDC is responsible for emergency preparedness. Remember, during our natural disasters of what happened in New Orleans with the hurricane, and the people were left there in the water. People were dying in the water. The city flooded and all the sewage is back up. There are bugs that are associated with this, all type of health issues. They help us monitor that. They make sure that there are boots on the ground, there are antibiotics, and we know what to send to know how to treat this to keep people safe. During these natural disasters, the fires in California, it was burning everything. It was not a forest fire. It may have started that way, but it was not. So when it burns homes, when it burns all these different businesses, plants, cars, asbestos, plastics, all type of chemicals are in the air that it's just not smoky air. There are all type of particles. These particles, if you breathe them in, can cause cancer in the future. So they monitor all this. They tell people you need to wear a mask because this area was known for oil, so these things are more likely to happen with you. For instance, like coal miners having coal lung, when the trains derail and they're carrying toxic chemicals. They're there to help us in the medical field, the providers, to know how to treat it and to let us know what we are dealing with. From this, the CDC has public health initiatives to support vaccination programs, because there's a reason why we vaccinate. I'm old enough to remember being in lower grades in kindergarten, having people who were in wheelchairs and on walkers because they had polio as a kid. And we vaccinated against that. So you now don't see people walking with shortened legs and young men being sterile because the childhood diseases were vaccinated, and we've actually eradicated some of them. But a lot of them are resurfacing because people are not getting vaccinated, because they're used to post-vaccination era where you don't see the sequela of these diseases. The CDC helps with the public health initiatives of these vaccines, like getting vaccinated for COVID, getting vaccinated for shingles, getting the flu vaccinations, and how they monitor the flu vaccinations. They watch the flu bugs mutate, and then they decide what to put in the flu vaccines. And all of this comes from these organizations. The CDC provides chronic disease prevention programs, all type of health promotions, like learning to find out if you have diabetes, if, you take a medicine that is killing people, they make sure we know all of that. Wealth of information. The EPA, the Environmental Protection Agency. Health is related to your environment. What's in your environment? We're humans. We take in food. We take in the air to breathe. We drink water. All of this has to be monitored. We have to regulate our air. As we talked earlier about the fires in California, can't be walking around breathing smoky air that has plastics and all type of toxins in it, because you will develop issues and health problems down the line. Land pollution, water pollution. It's a way to protect our citizens from dying and being affected with diseases. We're not immortal. We can be destroyed and eliminated by environmental factors. So the EPA, along with the CDC and the WHO, help us to stay healthy and to avoid the risk of some of these things. And the EPA also conduct research and monitors environmental conditions. So for instance, people in a particular town with cancers, the EPA will go out and monitor the environment. What's in the soil? What's in the air? Why is it that all these people are coming up with this particular type of cancer? So it's connected with the health field, because as we diagnose people with chronic diseases, with cancers, they're monitoring this. Was there a chemical spill? Was someone using a landfill and was not using the proper disposal? This all affects our public health situation. They provide community support, because if they do find spills, then they help us to clear them up or hold the big corporations accountable for the spills. And they also serve for emergency response. Now you may ask, okay, so there's another department related to our health and our public viability and mortality and morbidity. And that's the Department of Health and Human Services. So what do? They establish health and welfare programs. They oversee the programs that enhance health and well-being of Americans. They are the administrators of federal programs like Medicare, Medicaid, the Affordable Care Act. Health and Human Services make sure we get health care. Public health services through agencies like the CDC, the NIH, the FDA. They promote research with public health and safety. They provide funding and grants for health services, so your health clinics, your federally insured health clinics, for people who don't have insurance, but people who do have insurance, in your low socioeconomic areas, in your food deserts, Native American reservations. All of these people work together to make sure that we have adequate health care. We're safe health-wise, because we are not immortal. If we can decrease our risk of the environmental things, it helps us live healthier lives. We could do part of it, but these other agencies exist to help us with the things that we do not have control over. Let's talk about Medicaid. Medicaid was established in 1965 and is managed by the federal and state governments. It's there to provide health coverage for low-income individuals and families, including children, pregnant women, seniors, and people with disabilities. How is it funded? It's joint federal and state funding. The federal government matches the state spending based on a federal medical assistant percentage. There are states in the United States that chose not to accept this. Who benefits from Medicaid? Low-income families. It covers their doctor's visits, their hospital stays, long-term care, and prescription drugs. Children Health Insurance Program, which provides health care for all children, the elderly and the disabled, because Medicare doesn't cover long-term care. They give our elders and disabled Medicaid to cover the long-term care service. Pregnant women ensures prenatal care and postpartum care for our citizens in the United States. Rural and underserved programs expands care through community health centers. And how it does that, it recruits providers, healthcare providers, first-line people, by paying off their schooling, providing incentives to go back in these areas to provide health care. And if they've already had health loans for medical school, physical therapy school, nursing school. It will pay for their loans, their incentives for people to go back into these areas to provide health care. Maybe you don't know how many organizations benefit from Medicaid. Let's start off. Hospitals, physicians, nursing homes, mental health providers. It allows all of these people to take care of people who are underserved. They contract with states to deliver Medicaid benefits through capitated payments, which means it limits the amount they're paid per person. Pharmaceutical companies, Medicaid covers prescription drugs, providing a lot of people with their medications for diabetes, high blood pressure, cholesterol at reduced cost. Medical devices, walkers, wheelchairs, insulin pumps, all of these devices that people need to live normal lives with their diseases. And it helps nonprofit organizations offer preventive and mental health services. To take away from today's Ask Dr. J, the WHO, the CDC, the EPA, the Human and Health Services play critical roles in our health protection, in our disease prevention, in our regulatory oversight. And Medicaid supports a vast network of people, all populations. Medicaid is very important for the United States to provide health care. Hope this helped you understand all the different organizations that affect whether or not we get health care. Thank you. Like, share, subscribe, and stay tuned for the next The Healthy You with Ask Dr. J. If you have any further questions, tap the link, send me a message, respond, and let me know, and we will address on our next The Healthy You. Have a great day. And remember, your health is your wealth, and it is very important.